Welcome to your video on section 8.2 where we're going to discuss the general anatomy of the skull. Our skull is the most complex structure in our skeleton, and we have 22 bones composed of cranial bones, which we see over here encasing the brain, and our facial bones that are responsible for our facial features. We'll start with our cranial bones. This is going to form our rounded cranium, and it surrounds and encloses our brain. The roof of our cranium is termed the calvaria. So this is usually how we cut the skull in cadaver lab. We make a cut all around here, and then the skull cap that comes off is the calvaria. Our cranial bones are composed of our frontal bone, parietal bone, and occipital bone. And the base of our cranium is composed of our ethmoid bone, sphenoid bone, temporal bone, and part of our occipital bone. And for our facial bones, we know that they're going to form the face. It helps to protect entrances to our digestive and respiratory systems, and it gives shape and individuality to the face. It also forms the orbit or the eye socket. You can see that down over here, and also our nasal cavities. It supports our teeth and provides attachment sites for muscles of facial expression and chewing. And we have 14 total facial bones. We've got our paired zygomatic bones, our lacrimal bone, our nasal bone, the inferior nasal concha, which you see a little bit in here. We also have our palatine bone, which is not pictured in either of these figures, I don't believe, and our maxilla, which is in the orange, our unpaired vomer, so it's just one bone for the vomer, and our mandible. And for our cavities of the skull, our largest will be the cranial cavity, which is also termed the endocranium. This area is going to enclose, protect, and support our brain. We already talked about our orbits, where our eye sockets are, our oral cavity, nasal cavity, and then our paranasal sinuses. So like our frontal sinus, ethmoid sinus, maxillary sinus, and then in a different view we would see our sphenoid sinus. So let's talk about some of the bones in an anterior view of the skull. We have our frontal bone that creates our forehead, and our left and right orbits that are going to be formed by multiple skull bones. Two large openings within our orbit is our superior orbital fissure and our inferior orbital fissure, and we'll learn about what goes through here when we discuss our nervous system. We also have these superciliary arches that are our brow ridges. We'll find this superior to the orbits on the anterior surface of our frontal bone, and they are larger and more pronounced in males, just like our good friend here. And on our frontal bone, we have this depression in here called the glabella. This is an area superior to these nasal bones and in between the orbits. Our nasal bones are going to form the bony bridge of our nose, and our left and right maxilla bones are going to fuse in the midline, so right over here, and it forms most of the upper jaw and lateral boundaries of our nasal cavity. It also forms a portion of the floor of each of our orbits. You can see a little bit of orange in here in that medial inferior side. And it forms the roof of our oral cavity, which we can take a look at from an inferior view. Next, we have our mandible here. This forms our lower jaw, and our chin is created through this mental protuberance. We'll also see that we have these ridges in here called alveolar processes at the oral margins, and we have this on the mandible as well as the maxilla. On our maxilla, we also have this anterior nasal spine, and this marks the inferior border of our nasal cavity, and a nasal septum also is created in here, and that's going to be created by a couple different structures. what your septum is, well, the word septum means wall. So this is going to be a thin ridge of bone dividing your nasal cavity into the right and left halves. So I put this sagittal view of your nasal septum, and you can see it's made up of septal cartilage, the perpendicular plate of your ethmoid bone, and the vomer. If we look at this anterior view again, in the area where we have the green here, that is our inferior nasal concha, and that is a bone of its own. So it has its own bone. It doesn't belong to, let's say, ethmoid bone or sphenoid bone. It's a bone of its own. And the way that it is structured is that it has two scroll-like shaped bones on the inferior lateral walls of our nasal cavity. This is going to be covered with a mucous membrane, so as we breathe in the air, it really turbinates that air, and we get increased surface area in which that air can make contact with the mucous membranes. And here's just a figure of that anterior view of the skull with all of the structures. Now let's look at a superior view. We see 4 cranial bones here, our frontal bone, both of our parietal bones, and the occipital bone. We have some sutures in place here, which are immovable bones in the skull. Our coronal suture is going to cause an articulation between our frontal bone and the 2 parietal bones. The sagittal suture is connecting the left and right parietal bones. And we also have our lambdoid suture, and this is an articulation of the occipital bone with the parietal bones. Now for a posterior view, it shows a portion of the occipital, parietal, and temporal bones here on the side. It also shows us that lambdoid suture we just looked at between our occipital and parietal bones, and within this lambdoid suture we have one or more of what's called sutural bones. These are also called Wormian bones, so it's the green in here. And then we have on our occipital bone the external occipital protuberance. This is a prominent bump in the back of the skull. And then if we look a bit more inferiorly, you could see this a little bit better. We have our superior nuchal lines. This goes on either side here, and our inferior nuchal lines. And these are going to intersect the external occipital protuberance here. Now for our lateral view, we could see our parietal bone, temporal bone, and our zygomatic bone. We also see parts of our maxilla, the mandible, our frontal bone, and the occipital bone. Our lacrimal bone in here in green is going to articulate with our maxilla anteriorly and the ethmoid bone posteriorly. We do have this area called the pterion, and this is a portion of the sphenoid bone that is articulating with the frontal bone, the parietal bone, and the temporal bones. We also have our zygomatic arch here, and this is a fused portion of the temporal process of the zygomatic bone with the zygomatic process of the temporal bone. And we also have this very special joint in here where the mandible joins the temporal bone. This is called your temporomandibular joint, where our mandible is articulating with what's called the mandibular fossa of the temporal bone. If we take a look at our temporal bone, we see that we have this flattened portion in here that is called the squamous part of the temporal bone, and that is going to articulate with your parietal bone through this squamous suture. Another structure on your temporal bone is the external acoustic meatus. This is our external ear opening, and we have the mastoid process just posterior to that, and this is also a little inferior to the meatus. And lastly, we have the styloid process here, which is this pointed projection that is anterior-medial to the mastoid process. And here's that lateral view of the skull with all the terms listed. Now let's take a look at a sagittal sectional view. We can see in this view we have the perpendicular plate of that ethmoid bone, and this is helping to form the posterior-superior portion of the nasal septum. Inferior to that and posterior to that, we have the vomer that is also participating in creating that nasal septum. And here's that view that shows us how the maxilla makes the roof of the oral cavity by participating in the hard palate. This is formed as the anterior 2/3 being the maxilla bone, and the posterior 1/3 is formed by the palatine bone. And here's that figure on the sagittal section of the skull with all the terms listed. Now let's take a look at an inferior view. Most anterior structure is going to be the hard palate, and this is just another view where we see that maxilla as the anterior 2/3 and the palatine bone as the posterior 1/3. And posterior to that, we see our medial and lateral pterygoid processes or plates of our sphenoid bone. We have our medial pterygoid plate and a lateral pterygoid plate that help create the pterygoid processes. And we have a choanae as well. These are internal openings of our nasal cavity, and they are medially adjacent. If we look at a view into the skull, so basically the calvaria has been removed here. Of course, the brain is not pictured here. We can see several openings of the skull. First, we have the jugular foramen here. This is an opening between that temporal and occipital bone, and we're going to see the internal jugular vein move through here and several nerves, which we'll discuss in our nervous system. We also have this hole called the foramen lucerum, and this is between our occipital and temporal bones and is covered by cartilage. If we look at this inferior view here, we can see the carotid canal, and this is anterior-medial to the jugular foramen, and our internal carotid artery will pass through this area. So the carotid canal is a passageway for the internal carotid artery. Continuing with our inferior view, we have our foramen magnum, and you can see the foramen magnum from the inferior view and this superior view here. And our spinal cord is going to exit through this foramen magnum. Looking at our inferior view, we see the occipital condyles. These are going to articulate with the first cervical vertebrae of our vertebral column. And if you remember our vertebrae, the superior articular facet specifically is going to articulate here. Switching to our superior view here, we can see our hypoglossal canal just a little superior to that foramen magnum, and this is where we're going to have our hypoglossal nerve extending through here, and that nerve helps to supply our tongue muscles. And here's our inferior view of the skull with all the terms labeled. Continuing on, we have from this superior view our cribriform plate that it belongs to the ethmoid bone, and it is surrounded by this frontal bone. We are going to have a lot of perforations or openings in this cribriform foramina because it will serve as a passageway for our olfactory nerves to the superior nasal cavity. Extending upward, so we can see this a bit better in this sagittal view, is the crista galli. This is an elevation on the anterior-medial part of our cribriform plate and will have an attachment to our cranial-dural septa of the brain. So I wanted to show you the other structures here. First, let's start with that cribriform plate. And here's our olfactory bulb that sits right on top of it, with the olfactory nerves extending down into that superior area of our nasal cavity. And this is our crista galli right in here, and I wanted to show you the dural fold that is attaching to that anteriorly. Continuing on with this view, we have a large sphenoid bone that is posterior to the frontal bone here. It helps to unite our cranial bones and our facial bones. And we've got these lateral expansions on our sphenoid bone. Our greater wings, which are here and here, and our lesser wing, which is this triangular area in here. We also have the sella turcica. Remember, that means Turkish saddle. It's just a depression within the sphenoid bone, and it's where the pituitary gland is going to live. We also have these round openings in here. This is your optic canal, and in this optic canal, which you can see a little bit better in here, we will have the optic nerves extending from our eyes, so you can kind of see where the eyes would be here, extending back here so that it can make contact with the brain and send that information in. More on this in our nervous system. And if we look at our cranial base, we see the lateral regions formed by a petrous part. Petrous means rocky, so this is the rocky part of the temporal bone. And our posterior region is made up of the occipital bone. And on that petrous portion, we are going to see the internal acoustic meatus or internal acoustic canal, and this opens in the medial portion of the temporal bone. We will have proximally our facial nerve coming through here and our vestibulocochlear nerve. And here is a figure on the internal view of our cranial base with all the terms listed. Now for internal bones of the skull. Here you can see some of them: our sphenoid bone, the ethmoid bone, our inferior nasal concha, the vomer, and our palatine bone. And now for a clinical view on cleft lip and palate. A cleft lip is when we're going to have incomplete fusion of the upper jaw components of an embryo. So you can see here where we have a cleft lip and palate defect. The lip almost has a little slit within it that is extending from the mouth to the side of one nostril. And this is multifactorial etiology as to why this takes place. For our cleft palate, which you see over here, this is a congenital fissure in the palate's midline, and our left and right maxilla and palatine bones here have incompletely fused. So basically they didn't fuse, and the baby may have trouble swallowing or have food traveling from the oral to the nasal cavity. And same thing, we have a multifactorial etiology here as to why this takes place, and sometimes it's going to occur with that cleft lip. And this is just another figure showing you that incomplete fusion that can take place. We can have it unilateral or bilateral, or a secondary cleft. Now for an internal view, let's talk about our cranial fossae. These are going to be 3 curved depressions of our cranial cavity floor, and it helps to house the lobes of our brain. So we have an anterior cranial fossa in pink here, and then our middle cranial fossa is in the green, and in the purple is the posterior cranial fossa. We already mentioned our sutures, but let's go ahead and review them. Our sutures are immovable joints, and they help to form boundaries between our cranial bones. First, we have our coronal suture that's extending laterally across the superior surface of the skull. It is going to articulate our anterior frontal bone with the posterior parietal bones. Our lambdoid suture extends across the posterior skull surface and articulates our parietal bones with the posterior occipital bone. And this is named for resembling the Greek letter lambda. We have our sagittal suture that's extending from the coronal suture to the lambdoid suture, and we have articulation between our right and left parietal bones. If we look at our lateral view of the skull, we can see our squamous suture in here that is articulating our temporal bone with the parietal bone on both sides of the skull. Now, we mentioned these sutural bones in here, And I mentioned that they are also called Warmian bones. These represent independent bone ossification centers, which we covered in the previous chapter. And the most common and numerous is in the lambdoid suture, as you could see pictured here. Now for another clinical view. First on craniosynostosis. This is the premature fusion of one or more of the cranial sutures. And if this is not surgically treated, an individual is going to grow up with an unusual craniofacial shape. And the shape is going to vary according to which suture closed prematurely. So you can see that here is the craniostenosis taking place, and then after surgical reconstruction we have a more usual type of craniofacial shape. And then we have plagiocephaly, and this is going to be an asymmetric head shape. Sometimes children can put those helmets on so that we can correct that shape. It is caused by a unilateral craniosynostosis or a normal deformational factor. And let's take a look at the orbital complex over here. This orbit is going to enclose and protect the eye and the eye muscles, and it consists of multiple bones that are going to form each orbit. The way you can memorize what bones make up the orbit is this saying: "Please let me eat zucchini for supper." So the first P is for the palatine bone, which is a little difficult to see in this photo, but it is just that small little portion right in here. Let is for the lacrimal bone. Me is for maxilla. Eat is for our ethmoid bone, which you can see just a small portion of it in here, in that like light pink. Zucchini is for our zygomatic bone, which is nice and easy to see here. 4 is for our frontal bone, and supper is for the sphenoid bone. Now let's discuss the nasal complex. This is going to be an enclosing of our nasal cavity and the paranasal sinuses, and is made up of bone and cartilage. So when we look at our paranasal sinuses, para means surrounding, right, the nasal area, it's going to have these air-filled chambers that open into the nasal cavity. These sinuses will have mucous membranes that will help to humidify and warm our inhaled air, and they also will cause our skull bones to be lighter so that our head does not weigh so much. It can also provide resonance to our voice, and the 4 paranasal sinuses are the ethmoidal sinuses. Sometimes these are called ethmoidal air cells. We have the frontal sinus, our maxillary sinus, which is the largest, and our sphenoid sinus. And here's just a closer look at the nasal complex, and you can also see that curled up concha, inferior nasal concha, that is going to help to turbinate the air that we breathe in, and it's also represented over here. We also have a middle nasal concha and a superior nasal concha.